Everything inside of me was telling me there's something else wrong.
It felt like someone was pulling the bones in my neck apart. I thought I was gonna lose them.
He said you're gonna have to have surgery, and if you don't, it could be the end.
Next, 3 medical mysteries that defied the experts. Sean Towery is a perfectly healthy 25-year-old until crippling attacks of dizziness strike, and no one can tell him why.
I kept pushing him. You need to find a reason. You need to find what's caused this.
Then, bizarre headaches and spasms begin taking over Angie Abbas's life, but her doctors don't believe they're anything to worry about.
And I told my mom, you can fight my battle for me because I just didn't have the strength to do it anymore.
And Nicole Bonfig, born with a heart condition. But it's her mysterious stunted growth that has her mother running from doctor to doctor.
I was getting really worried and I was frustrated because I felt like nobody was listening to me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. For Sean Towery, childhood is a carefree time. The only problem he seems to suffer from at all are his chronic ear infections.
I remember the ear infections starting when I was about age 5, and they were the type of ear infection where you'd have blood and pus, keep you up at night.
The physicians would prescribe an antibiotic, and in a few days it would clear up. And then as he got older, it started to get more persistent.
Then, when Sean is 13, he visits a new ear, nose, and throat specialist who orders a CAT scan.
He sat down, he looked in my ear, held up the films from the CAT scan, and instantly said, "You're having surgery."
What the doctor sees on the CAT scan is a cyst deep in Sean's left ear. It's a cluster of dead skin cells called a cholesteatoma. If they don't remove it, it will continue to grow and could do permanent damage to Sean's hearing.
He explained it that he had to remove it, and then that was the cause of the bleeding and the drainage within my ear. I had surgery roughly a month later.
The surgeon goes in through Sean's ear and cuts out the cyst. The entire procedure takes less than 5 hours and goes off without a hitch.
And it was wonderful. And he never had problems after that.
For the next 13 years, Sean is completely symptom-free. No pain, no hearing problems. He seems to be in the clear. Then, when he's 25, something terrifying happens.
January 2004, got up, had my morning coffee, was going to get ready for work, and took a shower, stepped out of the shower, grabbed tissue to blow my nose, and instantly the room just started spinning out of control. My balance was unsteady. I was vomiting. I was shaking. The bottom half of me was flushed, but my face was very white, very pale.
He could not walk, weaving side to side. I was extremely worried.
Sean's family drives him straight to the emergency room.
When they saw me, they instantly thought, okay, we have a heart attack victim.
And I was very, very alarmed because I couldn't get to him. I couldn't be there to help.
They put me on the bed, bang, EKG right away.
The EKG shows that there is no problem with Sean's heart, but given Sean's history of ear infections, the ER doctor goes on to examine his ears. But he can't see anything wrong there either.
And at that time, he stressed, I feel as if something else is going on here because you do not have any inflammation in your ear. It made me think, what else is going on now?
The ER doctor prescribes some drugs for motion sickness and recommends that Sean get an MRI.
At that point, my job did not have benefits, so I was unable to afford such a procedure.
Sean puts off getting the MRI. 1 month later, he moves to Texas for a new job in a college recreation department. He's at work when an odd new symptom appears.
He told me that he could feel like movement in his head when he would move his head suddenly from side to side, that he could feel something loose inside his head.
If I was active, if I was playing this sport, I could feel something moving on the left side, and that was frightening.
I was very worried, I'll tell you. I didn't know what to do, but I bugged him to go get that MRI.
So we were back and forth, I can't afford it.
But I kept pushing him. You need to find a reason. You need to find, what's caused this.
But before Sean can schedule the MRI, disaster strikes.
So in September, I get on the plane to head back to Michigan for some weddings. We take off, everything's great. About 30 minutes into flight, a series of pops in my head, and they're in the left side of my ear. The last one is so loud that it's like a mousetrap. I instantly lose hearing in that ear, and the plane starts spinning out of control. I am getting violently ill. I'm hot, I'm cold, I'm hot, I'm cold, I'm vomiting.
Sean white knuckles it all the way to Detroit. Once he lands, his family rushes him to the emergency room. But when the doctor examines his left ear, all he finds is a mildly perforated eardrum.
And they said it was just a slight perforation, a little bit of dried up blood, nothing to be really concerned about. And I tried to tell them, same symptoms as before, and they're like, well, this probably is the reason, and, we're gonna give you some medication and you're gonna fly home.
The ER doctors give Sean Valium and motion sickness drugs for his flight home, and they urge him to see an ear, nose, and throat doctor. The drugs ease the pain, but it's clear to Sean and his family that something is still wrong.
I noticed that he wasn't hearing hardly anything I was saying, unless I positioned myself on the right side of him.
The dizziness is now constant and debilitating.
You felt like you're walking around in a drunken stupor. For weeks on end is how I felt.
Then Sean's primary care doctor refers him to Dr. Richard Hung, one of the top ear, nose, and throat doctors in Texas.
We let Sean give his whole story. He had symptoms of severe hearing loss and some vertigo and dizziness. But then when he started telling me that a year ago he blew his nose and that caused dizziness, and that really raised my suspicion for a possible inner ear fluid leak.
2 fluid spaces within the inner ear help to maintain balance, but Dr. Hung must conduct dozens of tests to find out if that is where Sean's problem lies.
Did a couple of the little hearing tests, failed. And he said, okay, well, we're gonna try a little balance exam.
And for that test, we lay them flat very, very quickly to see if we can stimulate any kind of vertigo or abnormal eye movements. And sure enough, on the left-hand side, he actually did have some abnormal eye movements.
The test indicates that Sean could have benign paroxysmal positional vertigo, a common inner ear condition that causes severe dizziness.
The only problem was that patients with positional vertigo do not have any hearing loss at all. That was an abnormal finding that did not quite fit with his story.
Dr. Hung is baffled. He orders a series of sophisticated balance exams. The tests turn up some unusual results, but still no answers.
And he's like, well, we're definitely doing the MRI, and we're doing a CAT scan.
Finally, on the CAT scan, Dr. Hung sees what appears to be the problem.
We found that there was an abnormal fullness inside the middle ear that was actually suspect for maybe another cholesteatoma, a recurrent one from 13 years ago.
He told me that I was gonna have to have surgery of some kind to remove that. I knew my hearing was gone. My fear was that the pain, the movement, all those things, I just knew it was going to be something worse than, what I had when I was a kid.
Dr. Hung refers Sean to specialist Dr. John Ogilvie.
When Sean came to see me, he brought a CAT scan of his ear with him. On that CAT scan, it was clear that Sean had a major problem.
He gets out his little pointer and he's showing me, okay, here's what Dr. Hung thought was a cholesteatoma cyst, and in fact, that's your brain.
There is a hole in his skull, roughly the size of a quarter.
Basically, my brain had worn through my skull and had fallen in my ear.
Sean is diagnosed with a temporal lobe encephalocele, an extremely rare and dangerous condition where a hole develops in the part of the skull that separates the brain from the ear. The hole may be a congenital defect, or it may develop over time as a result of repeated ear infections or other conditions.
The moving that Sean felt behind his ear was his brain. Every time he bears down to lift something heavy, his brain was being pushed down into his ear. I think the pressure changes that Sean experienced on that plane trip broke the camel's back. The last thin remnant of bone between his brain and his ear broke, and that's why it was so loud to him.
I was in complete and utter shock. I'm thinking, okay, how is this going to affect me? I mean, am I going to be brain dead? What are the ramifications?
It scared the daylights out of me. It truly did. I thought I was going to lose him.
I mean, it was as simple as you could put it. In order to correct this, you're going to have surgery, and if you don't, it could be the end.
The surgery is scheduled. It's 4 weeks away. If Sean gets sick before then, it could be fatal.
In Sean's case, there's no protection between his brain and his ear space. So if he ever got an ear infection, it would rapidly go to his brain and cause meningitis. That's a life-threatening condition.
Each day is an agonizing wait. And then suddenly, a new symptom appears.
He had a lot of discharge out of his nose, and it was just clear liquid, and at first we thought it was a cold. But he had called Dr. Ogilvy, and they had said that it may be brain fluid.
Sean Towery has just been diagnosed with a hole in his skull. Brain fluid is leaking out of his nose. Now, his surgeon must perform an operation in an attempt to save Sean's life.
They were going to actually have to drill a hole in the side of my head to move my brain out of the way.
There are many potential complications to this. The risks of this surgery include a stroke, brain damage. There's a big risk of seizures after this type of surgery.
At 10 a.m. on November 10th, 2004, Sean is wheeled into the operating room.
When they took him away, I just said, I'll be here when you come back.
The surgery should take 4 hours. Dr. Ogilvy will repair the hole in Sean's skull with layers of muscle, bone graft, and titanium plate. But upon opening the skull, he's surprised by what he finds.
When we opened up Sean's ear, we found the brain in his ear. But interestingly enough, we also found a cholesteatoma, a cheesy whitish material. So he had two problems. He had the brain coming down into the ear, and he also had a cholesteatoma going up into his brain.
Dr. Ogilvy also discovers why Sean has experienced such severe vertigo.
The cholesteatoma had actually dissolved the bone around his inner ear and had gone into his balance canals. And that's why he was so sensitive to pressure.
The surgery will now be much more complicated than Dr. Ogilvy had anticipated.
We not only had to bring the brain back up to where it belonged and to repair the hole in his skull, but we also had to remove all of the cholesteatoma so that it would not come back.
So we waited. And we waited. And we waited.
The nurse in the OR would call the waiting room, and I could hear the saw in the background, and that was probably the worst sound I've ever heard. And it was horrible. I was scared. I was devastated. I was worried, what happens if there's a slip, Does he become brain dead?
After almost 7 hours, Dr. Ogilvy completes the final stage of the surgery. And the news is good for Sean's family.
The surgery went fine. I was tired at the end of the day, of course, but there were no complications at all.
Dr. Ogilvy came and talked to us and told us that he probably would not get his hearing back, which at that point, I was glad just to hear everything went okay. He still has an ear, he can hear me, and so we're fine with that.
5 days later, Sean is discharged from the hospital.
I felt pretty good about 10 days after being released from the hospital.
He stopped complaining of the dizziness, and he said he didn't feel movement in his head anymore. It seemed back to normal.
After suffering 10 months of discomfort and pain, Sean feels lucky that he finally got the right diagnosis.
If the diagnosis were not found, this cholesteatoma would most likely continue to enlarge. It might have even gotten infected, causing an infection of the brain, and it could be fatal.
The reason it's hard to diagnose a temporal lobe encephalocele is that it's so rare. Most doctors will never see a case of this in their lifetime.
1 year later, Sean is healthy again. but his medical ordeal has changed his life.
My balance is not perfect. It's not like it used to be. And I'd say that's about the only limitations I have other than the hearing.
Sean's long-term prognosis is excellent. I think the chance of his temporal lobe encephalocele recurring is slim. We will have to follow him with periodic CAT scans and MRI scans the rest of his life.
People wait all the time to go see a doctor for something, to the point where they can't do anything for you. Be proactive. Don't procrastinate. If something's wrong with you or someone else, don't be afraid to tell the doctor.